Hi, folks. For those of you just joining us, we're going to get started in about 5 minutes here. We'll give a little grace period for those waiting to get involved. Actually, it looks like Councilmember Erickson's here, Jasmine. I think he's actually listed as an attendee. Can you upgrade him to a panelist for us?
No problem. All done.
Great. Thank you. Perfect. Hi again, folks. For those of you just joining us, we're going to give everybody a few minutes to log on and get rid of some technical issues, and then we'll get started in about 3 minutes. Thanks for being here. All right, I think we're at the 12:05 marker. If Councilman Erickson, you want to take it away, we'll get started.
Thank you so much, everyone. It's so good to be here with you today on what's a virtually dry event, but will be entertaining as well. But here on our rainy day in Los Angeles and West Hollywood, I'm so thankful that the city could partner with the American Red Cross for this advanced study forum to talk about this amazing new pilot that's really going to work and how we all together come about and change the ways in which we look at blood donation. And this pilot study is so critical to me because growing up as a gay man in a small conservative town of Wisconsin, I always knew that I couldn't donate blood or that it was discouraged. And changing that narrative for not only our generation, but also generations to come is something that can result in life-saving techniques and capabilities for everyone. I want to thank all the partners that have been involved in this, and I want to encourage everyone to get involved in this study because together we can bring about this monumental change these draconian laws, and make sure that we're all working together in a more equitable and fair way. And I'm going to turn it over to the people that are going to dazzle you with all the information, and I'll turn it over to you, Joy and Sean.
Great, thank you, Councilman Erickson. Jasmine, next slide, please. So we're going to go over a few things today. First and foremost, I want to make sure everyone's staying safe with all of the tornadoes that came last weekend. I hope all of your family or friends have stayed safe, or they're getting the support they need in those communities. Second, I want to really extend that gratitude on to the city of West Hollywood, obviously Councilman Erickson for sponsoring this, but the staff have been incredible. Jasmine, Andy, Derek, the entire team in West Hollywood has been profoundly supportive of this, and we couldn't be more grateful. So today we're going to go through the advanced study and what it is. We're going to talk about who can participate. I'm not going to steal too much of Dr. Friday's thunder here. I'm going to let her really talk about the meat of the advanced study. We're going to leave some time for some questions and answers, and then obviously thank all of our partners at the end as well. Jasmine, next slide, please. Again, thank you for joining us on this rare rainy day. Next slide, please. This is Councilman John Erickson. All of you are familiar with him. He came up already and gave his story. Thank you for sharing that, by the way. If you just next slide, please. I think we're going to slide through these pretty quickly. I'm Sean. I'm the executive director serving Western Los Angeles here. I am honored to be on this panel and to really help promote the advanced study and talk about why it's so profound. I, again, won't steal Dr. Friday's thunder, but this is close to my heart. I've been working with the Red Cross for about 7 years. 6 of those years were with biomedical services. So I'm very well versed in this policy, the changes that have been made to it over the last, even just in the last year. And I'm very enthusiastic and excited about this opportunity to really continue that change. So without further ado, I'm going to introduce Josh Gilstein. He's one of our first participants up in the Bay Area to really talk a little bit more about his experience. So Josh, thanks for being here. Thanks for sharing your story. Please take it away.
Thanks, Sean. Hi, everyone. My name is Joshua Gilstein. As Sean mentioned, I participated in the advanced study back in August of this year in the Bay Area. And, before we go into all the details of the study that Dr. Friday is going to walk us through, I wanted to take just a few minutes to share my story with all of you. So you might be wondering what the advanced study is. So when my friends ask me, I tell them that it's an FDA-sponsored pilot study in collaboration with 3 of the nation's largest blood centers, including the American Red Cross. And the study is focused on evaluating alternatives to the blood donor deferral policy known as Men Who Have Sex with Men, or MSM. And the purpose of the study is to determine whether a different donor deferral policy can be used at blood centers nationwide. So I enrolled because I wanted to play a part in the study that could potentially lead to changes in blood donor eligibility for gay and bisexual men like myself. I wanted to do my part to create a world where I'm able to donate blood in the future. And I understand the hurt that the blood donation policies have caused the MSM community, and I wanted to be part of the solution. So what was my experience like? Well, I was really excited when I signed up for the study, and as my appointment drew near, I will say when I arrived at the blood center, I was a little nervous because I'd never been inside a blood center before and I didn't know what to expect. I was anxious about entering a new space, particularly one where I couldn't donate blood. And I was a little worried about what the environment would be like throughout the process. But I'll say once I checked in, I was relieved to find that the staff members running the study were super warm and welcoming, and it all went super smoothly. So from start to finish, the whole process took about an hour to fill out the eligibility questionnaire, the study questionnaire, and give a small blood sample. The staff happily answered all of my questions and also listened to my feedback about the study. And then I returned 3 weeks later to get my results and fill out one more questionnaire. And I appreciated that I was compensated for my time for participating as well. So my ideal future is one where everyone is able to donate blood, regardless of their sexual orientation, and that eligibility is determined by an individual risk assessment. I envision that our entire LGBTQ+ community is invited to participate in the life-saving activity of giving blood. My vision is that we, as a community, come together to make this study a success, reaching the 2,000 participants nationwide and about 300 in Los Angeles. Our community is powerful and resilient, and I know that we can make that vision a reality. Thank you, and I'm now happy to hand it back to Sean.
Josh, thank you. One, for you're generously sharing your story here, but also for really stepping forward and being a part of the change that we all desperately really want to see here. I hope it gives everybody on this call a little bit of a window into the experience for our participants in the advanced study. The bottom line is, it's quick, it's easy, and you are making or helping to make profound change with this policy. So part of this next phase, Jasmine, next slide, please. I have the honor of introducing Dr. Friday. She's our medical director here for Los Angeles for the advanced study. Previously, she was our medical director for biomed here in the Los Angeles experience. So she knows a little bit about blood services. She is going to give you an in-depth rundown of the advanced study. So bear with us for some of the jargon that's included as well. And really, hopefully give you a little bit more insight as to why this is so groundbreaking and inspire you to share this with your family, your friends, your community, the people that you know that are in the gay and bisexual community, or steward them through this process and hopefully get them enrolled as participants. So without further ado, Dr. Friday, please take it away.
Okay, thank you so much, Sean, and thank you, Josh, and thank you, Council Member Erickson, for today's webinar. Josh, that was a really great sharing of your experience. Thank you so much. And I have to echo what Sean said in his expressing his gratitude to the West Hollywood City Council, Council Member Erickson, his staff, especially Jasmine, who is helping us out today and has gotten us on our way. So thank you. If I could have the first slide, please. And next slide. Okay, well, ADVANCE, as you've probably guessed, is an acronym, and incredibly, it actually kind of describes what the study is. Assessing donor variability and new concepts in eligibility. And perhaps I would not be allowed to do this in some of our documents, but in parentheses, put for, at this point in time, for gay and bisexual men, or men who have sex with men. What I like to do is give you a more in-depth view of ADVANCE, briefly go over the history of the FDA's policies related to blood donation by gay and bisexual men, and then talk about specifically how each of us can make enrollment a success, either by enrolling yourself if you're eligible, or by getting the word out to people who could be eligible. Next slide, please. If you could actually, okay, well, let's just start with the first one. From 1983 to 1985, could you advance the slide? There you go. Okay, 1983 to 85, MSN were asked by the FDA not to donate blood, as well as other groups that were identified as having higher risk for HIV. And then, if I could have the next bullet, please. From 1985 to January 2015, Men who had sex with another man after 1977 were permanently deferred. Why 1977? That is the year that it's believed that HIV entered the US. So that is why that year keeps popping up. Next bullet, please. And then between 2015 to April of last year, the deferral period was different. So rather than a permanent lifetime deferral, it was a 12-month period from the time of the last sexual encounter with another man. Next bullet, please. And then last year, the deferral period changed again. So it was reduced from 12 months to 3 months. So that's what it currently is right now. And I would like to call your attention to the purple line, the last line on the slide, that one of the things that all these bullets have in common is the deferrals were based on the time since the last exposure. So makes sense, this is called a time-based deferral, but if you could just keep that phrase in mind as we go on to the next slide. So this is the FDA wording on this first bullet regarding the purpose of the advanced study. And it is to provide data that will help the FDA determine rather if a different approach than a time-based deferral could be used. And that would be a deferral based on individual risk. So I will just read this to you if you will allow me to provide data that will help the FDA determine if a blood donor history questionnaire based on individual risk deferral would be as effective as a time-based deferral in reducing the risk of HIV in the blood supply. I think possibly a shorter, simpler way, unofficial way to put this is to evaluate alternatives to the FDA's MSM donor deferral policy. Next slide, please. Okay, so just to hit some high points on the background, this is funded by the Food and Drug Administration. So all the sites around the country that are participating, the staff that are part of this are on this FDA grant. It was designed through a collaborative process, the Blood Equality Working Group to assess the potential risk of alternative approaches to deferring and selecting blood donors. The Blood Equality Working Group was founded by the Gay Men's Health Crisis and FCB New York to look at, and if possible, to bring about working with regulatory agencies and other organizations, changes in the deferral policies for MSM. And they are very committed to this goal. And next bullet, please. So ADVANCE will not be the study that brings about immediate change. It is a preliminary or a pilot study that could help determine the feasibility and the size of a larger follow-up study to determine if further reduction or even elimination of a time-based deferral for MSM is possible. The enrollment goal of ADVANCE, as you've heard from Josh, is 2,000 participants in the United States by March of next year. And each of the US sites will be enrolling 250 participants. And of course, Los Angeles, being one of those cities, has a goal of 250 enrolled participants. And just, make you wait a little bit. I will tell you in a little while where we are in meeting that goal. Next slide, please. So the centers that are participating in the United States, the blood collecting organizations, represent about 60% of the US blood supply. And they include the Red Cross, Vitalant, which has its footprint on the West Coast, and also southeastern United States, and then One Blood, which collects predominantly in Florida. Next slide, please. Okay, so this shows the distribution of the cities. Red Cross cities are in Washington, D.C., Atlanta, Georgia, and Los Angeles. And then One Blood has sites in Orlando and Miami. And then Vitalant has its sites in Memphis, New Orleans, Baton Rouge, and San Francisco. Study enrollment started in Washington, D.C., the first Red Cross site and the first site to come on board in January of this year. And then between January and August, the other sites were brought on board, and LA joined in midsummer of this year in June. If I could have the next slide, please. Okay, so the participation criteria are really pretty basic. Next slide, please. So the enrollees should be male by birth designation, ages 18 to 39, have had sex with a male at least once during the past 3 months, is willing to donate blood at some time in the future. This is really important because we love curious people. We love curiosity. We would like curiosity combined with excitement and interest in donating blood in the future. We are looking forward to, as information becomes available and as the FDA rethinks and works through its policies, about having people, the MSM community, who are qualified to be donating blood. So I'll just keep on going. Yeah, there we go. For each geographic area, so the prospective enrollee must live in a geographic, in a zip code determined region. The reason that zip codes were selected is because it preserves the unique demography for each site. And then appointments are required, but easy to schedule through the advanced website, advancedstudy.org, or you could skip having to type that in and simply scan the QR code that is on your screen here, and also on printed material such as posters and flyers, and that will just take you right to the website. The next slide, please. Okay, so this is the opening screen if you were to go to the advanced study site, and this provides information obviously about the advanced study. I'm covering a lot of it today, and you've also heard some. And then you can scroll down to the participating site that is closest to you, and by clicking on that, that takes you to a calendar, and you can select an available appointment. Really pretty simple to do. While I have this opportunity to mention that the Culver City site and the Pasadena site in the Los Angeles area have appointment hours between 9 to 4, Monday through Thursday. And then the LGBTQ Center every other week also has appointment times from 9 to 2. So information that you might find helpful if you're considering enrolling. And the next dates for the LGBT Center are January 15th and 29th. So just wanted to get that information out there. So if we go to the next slide, please. So Josh has really beautifully covered what an enrollment experience involves. 2 short visits, one to basically sign up, have your eligibility determined, provide informed consent, very, very important. The study is thoroughly explained. And signatures, of course, your signature on that states your understanding, but also there's an opportunity should you have any questions or concerns during that session. And then complete an advanced study questionnaire, and blood samples would be collected for HIV and for PrEP usage, specifically tenofovir. And then the second visit is just a few weeks after the first one, with a return to the enrollment site to receive the test results. And of course, prior to that, you'd sign another consent form and then complete an additional questionnaire. And just looking at the last line there, the FDA, the grant, recognizes that people may have travel and other expenses associated with participating in the study. So somebody that is able to go through the entire process would be provided with $85. Okay, next slide, please. Next slide. Okay, so what is Red Cross doing nationally and also within Los Angeles to support this extremely important study? First of all, it's contributing about 40% of the advanced participants, and right now, Red Cross has enrolled more than 50% of people who have been enrolled nationally. There are 3 major Red Cross advanced enrollment sites, which we've already talked about, LA, Washington, DC, and Atlanta, Georgia. Uniquely, Los Angeles has 2 Red Cross enrollment sites, Culver City and Pasadena. The other sites, the other cities only have 1 that I am aware of. So we have 2, recognizing the very large geographic area that we serve. And uniquely, LA has 2 community partners, the LGBTQ Center and also the City of Hope. And we'll talk a little bit more about what they're both doing shortly. Well, I'll just go ahead and jump into it. The LGBT Center is an enrollment site. It's also advertising on social media and getting information out in other ways. City of Hope is supporting community events that are optimal for recruiting potential participants in the study, and also running social media ads corporately. So they've been great partners, and it's just been a pleasure to work with them, and they are contributing much. The Red Cross is also committing significant resources, both on the blood side. The regional recruitment and communications is involved, and then also humanitarian services. And just if I can name somebody by name, Joanne Nowlin is the president of the LA Humanitarian Services, and she has been supporting the study. Sean works with her and has worked closely with West Hollywood City Council to make this event happen. So thanks to everybody who's doing this part of it. The other thing that we're doing is collaborating with sponsors. We're attending events in Southern California. Just to give you an idea, obviously today's event, the Advance Forum, but there are plans to have sidewalk pop-ups with recruitment material. And grab people as they're walking by, talk with them about the advanced study. And also there will be some social media ads that will be sponsored by the City Council. Just a few other things. The AIDS Healthcare Foundation has committed to promoting the advanced study at some of their testing events. In September, Paramount Studios had a panel discussion about advance and is now working on a public service announcement. Another fun event where we have been recruiting is at something called the Queer Mercado in East LA. It's a monthly event. And by the way, there is one coming up this Saturday. It's from 10 to 4. They have a website you can, or a Facebook account where you can get additional information. And City of Hope has been very supportive of that, just the logistics. You know, when you start thinking about attending an event and you need a pavilion or pop-up, you need a table, you need materials, and it's a fairly involved process. And City of Hope has been great supporting those, specifically Austin Santiago and members of the Blood Donor Center headed up by Dr. LaFon Zhuang. And then the Palm Springs Pride event that Austin from City of Hope attended and promoted Advance at that event. So there now are several other organizations that have been identified to approach for networking and promotion. And so we will be following up with some of you, all of you. Some of you may not know that you have been suggested as a go-to person or organization, but I hope you don't mind when you hear from us, and we'll be looking forward to working with you and everyone else who's involved. If we could go to the next slide, please. So how can we get the word out? Lots of ways to do this. I am happy to be able to make a correction to this slide. We actually need to enroll 150 more participants because this past weekend, as a result of the LGBT Center's enrollment participation, we hit 100 in our enrollment. So we need 150 more to get us to 200. But thank you so much to the LGBT Center for getting us to that magic number that we've all been really pleased about. Thank you. Other approaches were really only limited by our imagination, social media, other types of media, outreach, PSAs, interviews, flyers, posters. I know these are kind of, paper hard copy things. The important part of printed material is the QR code, because that, as I mentioned, will get you to the website, people to the website. I don't see people carrying a lot of flyers around, but I do see them scanning the QR code so they can read more about Advance and also sign up if they are eligible. Outreach by our partners, Red Cross certainly is promoting it, corporations are doing this, and then uniquely, community and government leaders. And this event today, being sponsored by the West Hollywood City Council, is the only one that I know of, and my colleagues, Dr. Stramer and Lauren Crowder, know of, that has supported an event like this. So this is really special, and thank you so much. Okay, if we could go to the next slide, please. Okay, so if you are potentially eligible for participation, please make an appointment and enroll if you're eligible. Other folks scan the QR code, check out the website, talk with friends, family. As you read about Advance on your social media, share, get the word out. And word of mouth and social media, we are collecting data on how people come to the Advanced study as participants. Word of mouth, social media play a big role, with social media now accounting probably for more like 40 or 50% of the people for whom we have data. And then we also welcome your suggestions on additional ways to get the information out there. So if you could send us leads, if you could introduce us to people or organizations who you think, who you network with, who you think may be able to help us promote Advance. Next slide, please. So this just shows you, gives you an idea of how many organizations are participating in this study. And so the American Red Cross, with its two partners in LA, the LGBT Center and City of Hope, and then other Red Cross partners, Atlanta Pride, Pride in the City, which is the City of Hope, and then Whitman Walker, who actually designed the advanced graphics for the website. And of course, there's Vitalant, One Blood, and their partners around the country. Next slide, please. So this is the obligatory slide with a lot of information on it, but this is important because this represents the all this information represents the members of the advanced teams throughout the United States that are working on this study. So on the left, in blue are the Red Cross staff who are participating, and the people who are more local, I've double asterisked their names. Jay Winkenbach, who's a blood donor executive who actually has been very active and wonderfully so in the advanced study. Sean, you've already had the pleasure of meeting. Mariam Mahudin, who is with communications, and then the people who work with and meet the enrollees and do the face-to-face or do the interviews, collect the blood samples, are listed as well. And I want to name them because they've been so terrific in in helping people get signed up. So Mahmoud Tahoun, Latrice Lanehart, Lillian Castillo, Pam Smith, Selena Vasquez. So all these folks with the asterisks are LA based, and of course we don't want to forget Josh. Thank you so much, Josh. He's further north than we are, but has been so involved. And then thanks to our Red Cross partners. So the LGBT Center, I do want to mention them by name: Dr. Risa Flynn, Kyle Ryan, Ruben Rivera, City of Hope, Dr. Zhuang, Austin, San Diego, Casey Ueno, and then City of West Hollywood, Councilmember Erickson, Andy, Derek, Jasmine. So thanks to all of these people. And I won't go through everybody else's name on this slide, but I think it speaks to the dedication and commitment of blood centers around the country who are involved in this study. And I think this next slide. And I would like, I'm happy to take questions. Sean will be helping me with those, but I just want to close by saying that the FDA really is rethinking its policies. The FDA is serious about this study. And in order for anything to change meaningfully, we need people to be involved in the study, to sign up, participate. If you're not eligible, please get the word out. We hit 100 in LA. We wanted to do it by Thanksgiving, but we have done it, and hoping that very soon we will see those numbers climb much faster, and hopefully as a result of this webinar. So thank you very much.
Dr. Friday, thank you. And I can't say it enough. I think passing that 100 participants milestone was pretty exciting for us in here in Los Angeles. I'm confident that with the support of the folks on this call, the City of West Hollywood, and our partners here in Los Angeles, I'm cautiously optimistic, I should say, that we can not only reach that 250, but we can surpass it. So thank you, Dr. Friday. We did have one question come through. So folks, if you do have any questions, please put them into the Q&A portion of this, and I'll try to get to them. This is from David. David asked why the cap was at 39. And David, and I answered this in the chat too, but for those of you who haven't seen it, originally the study was limited to folks between 18 and 30, but it was expanded to 18 to 39 in order to obtain a broader demographic analysis. The study was really limited to individuals between the ages of 18 and 39 because this is the age range that represents the highest incidence age group for HIV infection. So it's this data that the FDA will use to analyze the standards for the next policy or the next study going forward, and hopefully be the broader change for the overall MSM policy. Dr. Friday, did I answer that correctly?
That's exactly it. Thank you.
Of course.
Nice work.
Anybody else? Questions? Okay. Before I hand it off to our gracious host and sponsor, Councilmember John Erickson, I really wanted to thank all of you again for being here today. I know some of these names are familiar to us, so I can't thank you for your unending support and really your advocacy on this. It's one of the things that's, I have been waiting and very eager to see change on this realm for a long time. So again, thank you to the City of West Hollywood for making this possible today, to Josh for sharing your story, to Councilmember John Erickson for really bringing this to the forefront and helping us really get this out there. Please, my call to you is to share this with your friends and family. Have the conversation with them, give them the information that Dr. Friday shared with you today. And if you do have more questions, please feel free to reach out to us at, or we'll put our email addresses in the answers here in a moment. But I thank you. It's a really big deal, and I'm really excited about this change this helps implement. So, Councilmember Erickson.
Well, that was quite the presentation, Dr. Friday. I mean, I loved hearing all of this. Sean, you're amazing. Joshua, thank you for coming on and sharing your story about why you participated. It's through sharing our stories, it's through making sure people know that they're not alone when they decide to take on and participate in such a groundbreaking study like this, that they're part of a community. It's so great to see individuals like yourself doing that. And, so how do we get involved? How do we get engaged? Okay, so everyone needs to tell their friends who fit the parameters to participate. I'm going to be sending out and doing more media all over the world on this and pushing it out because it's so critical that we get people involved to hit those numbers. But also to emphasize what Dr. Friday was saying is that it's time for a change, and that the FDA is really looking to change on this really important topic. And we need to make sure that other people are getting involved and knowing that this has been here. The history of harm, the history is something that we've acknowledged and looked towards, but it's how we're getting to this new future that's the most important piece of this whole study. And I'm so thankful that you all approached the City of West Hollywood, that the City of West Hollywood can work with you and will be working with you, and will be a partner with all of you. So share, 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 tell your friends. I'll be telling everyone I know, which is a few people here or there, but we'll be making sure that everyone gets involved, because this study can help make sure that we're changing the world and really saving lives, as we've always talked about. Did I miss anything, Dr. Friday, Sean? Anything else you want me to say?
I think you spoke beautifully, and I'm probably stealing Dr. Friday's words right now, but we couldn't be more grateful. And we hope folks leave here feeling inspired, invited to participate, and really enthusiastic and excited about the future here. I would also be remiss if I did not thank Selena, our board member, Selena Vasquez, for connecting us with Councilmember John Erickson and really presenting this. So thank you to Selena as well. Please.
Oh, am I on?
It's all you, Dr. Friday. I did not
I'm so
transition that
sorry.
very well.
Okay, you didn't tell me this part of the script. Anyway, I just want to thank everybody who is on this call today, taking time out of your busy days. And I am very confident, and we're very grateful that you have put the effort in to learn more about the advanced study. We ask a little bit more of all you, as we do ourselves, to continue to promote advance. And I would just like to wish everybody a very safe day as you're out driving, and want to wish people a great holiday season and a wonderful 2022. Thank you.
Thank you, Dr. Friday. Thank you, Josh. Thank you, Jasmine, Andy, City of West Hollywood, and thank you to all of you for being here on this Tuesday afternoon. Be well and take care.